I grew up with a family background of construction, and I liked using my hands. And so neurology and neuromuscular disorders got my interest started, but being able to use my hands to help people was really where my passion came along. I am the chair of vascular surgery at the Cleveland Clinic, but I have several things I'm quite interested in. One of the things I've always had an interest in is when these minimally invasive solutions fail, of how to treat those failures. One of the other things I've been interested in is carotid disease. And then the other thing I've really had a passion about is treating young athletes that have exercise-induced leg pain or popliteal artery entrapment syndrome. It's an uncommon problem. There's only 5 or 6 of us throughout the country who treat a lot of it. The really amazing thing about vascular disease is we're the only specialty that does longitudinal care of our patients. I always sit there and say that you never really understand what it's like till you've been on the other side. And my mother has been a patient here, and my father, my wife, I've been a patient here. As a patient, where I might tell you need to stop smoking or do these things, you might get upset because those things are hard to do. But I'm always going to look out for what's best, and we're in it together. I'm going to be vested in seeing you, and I'm going to be vested in your health and how we improve your health. And just like you'd want someone to do to your family, I may not know everything, but when I know what's important, I'm going to find a way to figure it out. There's minimally invasive options, there's open surgical options. And then once we do it, we're going to follow it because it can likely come back where we've treated or on the other side or at another part of the body. I get to work with some of the smartest people from every aspect of medicine. I get to see complicated patients that I'm able to do amazing things for. I recently had a patient who was sent by another surgeon. I had 2 other partners help me do this case. I don't think this guy would have survived many other places, but because I had a team of teams to work with to help with the ICU care, help with the intraoperative care, we can get away with doing things here that I just don't think you can coordinate in many other places in the world. The hug you get from the patient when they've done well, the hug you get from the family member that you've really taken good care of their patient, and the fact that you get to see them now for many, many years and become their friends. A really enjoyable visit is not just talking about their health, it's their family and getting to talk about my family to them. When I'm not at the hospital, I am passionate about college athletics. I went to Notre Dame as well as all my children and my wife, and so I tend to get to almost every home game. And then with 4 daughters, I really just love getting to spend time with them, with my wife.